I'm cancer rehab specialist, Dr. Leslie Waltke. From the tip jar, we are talking about chemotherapy-induced peripheral neuropathy, or CIPN. Peripheral neuropathies in the hands and feet are fairly commonplace in people undergoing chemotherapy using drugs in the taxane, platinum, and vinca alkaloid families. So drugs like Taxol, Taxotere, carboplatin, cisplatin, oxaliplatin, vincristine, etc. These neuropathies are typically sensory and manifest themselves as paresthesias, dysthesias, cold sensitivity, and sometimes pain. These sensory neuropathies can be problematic on multiple levels. First, if they become symptomatic enough, it will negatively affect the patient's function, safety, and quality of life. They can also cause problems on the cancer treatment side by leading to treatment delays, the need for chemo dose reductions, or even requiring a discontinuation of the chemotherapy altogether. And of course, this can negatively impact overall survival. There are some medications that can help reduce the amount of neuropathy patients feel, such as gabapentin. But currently there are no good evidence-based medications or treatments that can prevent or eliminate CIPN. But yes, you as a physical therapist can still assist in function, quality of life, and perhaps impact your patient's overall survival. Though there is some evidence that exercise can decrease the amount or intensity of these sensory neuropathies, in my opinion, if it does, it is very, very minimal. What I see most often is people with these sensory neuropathies significantly reducing their activity and exercise levels, which then in turn leads to a secondary loss of strength, motor control, and function. Now, when you drop these issues on top of a person who already has fatigue and nausea from chemotherapy, it can dramatically compound even more their inactivity and further their cardiopulmonary, musculoskeletal, and functional decline. Here are the bullet points I go over with my patients. Number 1, though we can't fix the sensation, we certainly can improve their strength and functional loss, if not prevent it from happening in the first place. Number 2, being inactive while waiting for the neuropathy to resolve will only lead to further loss and a longer recovery. Number 3, when they step on their sore feet or use their sore hands, even if it temporarily increases their symptoms, it is not causing any further damage. Number 4, I will then work with them to find alternate modes of exercise that are comfortable and doable for them. And then finally, number 5, I will really drive home with them my saying, it is better to be numb and tingly and strong than numb and tingly and weak. Let's go with strong. I'm Dr. Leslie Waltke. Thanks for making the world better for people with cancer. Have a great day in the clinic.